As you are aware, breast cancer is a very common cancer among women. It's actually the leading cause of cancer death among women, not only in India but also in the rest of the world. But a lot of us are not aware that we also can see breast cancers among males. Although the incidence is very less, as per the global records, the incidence is close to 1 to 1.5% of all breast cancer cases, but it becomes significant when we talk about male population. And many a times these cancers go unnoticed. So what is very interesting about male breast cancers is that usually they developed at a slightly elderly age, or in the second half, or you can say the post the age of 50 or 60. We don't see them in younger patients, whereas breast cancers in females is a wide range. They can as young as 20 years we can see breast cancer, and then as old as 80 or 90 also. So that is one important difference. Second difference is that in male breast cancers, most of them are hormone dependent cancers. They are receptor positive cancers, and treatment essentially is not very different from what happens in the females. So that is very important to note. But what is important is the diagnosis. So if a male person has a breast lump, it should not and it has been there, a lump or an ulcerated lesion near the breast or the nipple in males, they should not ignore it, and they should be going to their doctor or a surgeon or some medical professional, and then one should get it examined so that one can catch a male breast cancer early.
Here in the domain of radiation oncology, I wish to emphasize that yes, it has undergone a tremendous change in the way we plan, we think about the breast cancer, and to minimize the side effects, and also to get a better tumor control with all the technologies that we are using so as to achieve that endpoint. So a little bit on the radiation oncology aspect is the most, I would say, a mathematical and from a physics point of view, the most exact of the oncological sciences, and that has undergone a sea change of refinement with the computing, with the processing and the techniques that we have improved on. Especially for the breast cancers, when we are looking for a toxicity induced by chemo, we look to reduce the adverse events with regards to radiation by employing new techniques, new technologies. One of them namely is a breath hold technique, which I would like to sort of exemplify in a way that we acquire the set of imaging, which is the most important part in any radiation oncology planning paradigm, is in a particular format, in a particular phase of breathing, which keeps basically the heart away from the target structure, namely the breast that we are treating, and helps us to achieve a higher dose and a minimal toxicity to the heart and the lungs. Newer technologies like surface guidance, the way we are monitoring the patient, also sort of guides us, tells us that if there is any setup discrepancy, it can be corrected, and now in a real-time manner rather than contemplating or being wise in retrospect. So all these things help us. They sort of improvise or improve on whatever we are doing. In view of these technological advancements, the patient is a part of the treatment paradigm, and he or she needs to understand and learn with regards to these different processes. Yes, it can be daunting at first, but as the patient gets comfortable, the patient is coached, the patient is guided, the patient becomes aware and tends to do well with regards to the procedures, leading to an effective outcome with regards to the breathing movements and with regards to the treatment delivery. The patient has to be counseled, and the patients do tend to understand the treatment carries a meaning with the technological overview or with the technological insight that the side effects are going to be reduced. The patient feels comfortable, the patient is confident then once he or she understands about the process.
So technology helps a lot, and these are very simple technologies. We ask the patient to take a deep breath and hold the breath. So we do a treatment which is called a breath hold technique treatment. But how to make sure that the patient is actually holding the breath correctly, and also how to make sure that the radiation is going only when the breath hold is happening. And that is where the technology comes. Now we have different ways of doing these breath holds. There are methods where we can form respiratory motion. We can assess subjectively and objectively both. We can create graphs how the patient is breathing, inhaling and exhaling, and at the same time we can freeze the radiation when the patient is inhaling and taking a deep breath. So that is one technique which is called an RPM gating technique. Then we also have surface guided radiotherapy. This is something which is very, very interesting and which actually helps the patient, is much more patient friendly, because here the patient, even those patients who are not able to hold the breath, there are patients who find it difficult to hold the breath, either they are elderly patients or they have some lung conditions or whichever is the reason. Here the surface guidance helps us because there is a tracking of the surface by cameras, and the movement of the chest can be seen, tracked by these multiple points on the surface, which is tracked by the cameras. And there are infrared cameras, there are the regular cameras which can actually track the surface, and we can assess the motion and the radiation can accordingly be delivered. So this is another important method of doing it, and this is definitely probably more patient friendly than a RPM gating technique. So that is one of the important things. So it is now becoming more and more common to adopt these technologies for a good quality precision radiation, because as I said, a good quality radiation today will result in a better quality of life in future for this care radiation. So finally, in conclusion, I would like to say one sentence, that is, together we innovate for care. And when I say together, I mean a team which comprises of the clinicians themselves, a team of scientists, definitely a very big important role played by the industry, the pharma industry, the industry which makes these radiation accelerators, the supportive industry which makes different kinds of equipments to make these treatments more precise, and of course, last but not the least, our patients.
So one message in which we can innovate for care, that together we concept would be a human touch with a technological underpinning.